Hyperhidrosis, excessive sweating. In this video, we're going to be talking about all things related to excessive sweating. I'm Dr. Shah.
Dr. Maxfield.
And on this channel, Doctorly, we talked about all things skincare and dermatology. This falls into the dermatology category, but hyperhidrosis is a very, very, very common issue, and it's something that really affects the people's quality of life. And so I see patients with hyperhidrosis all the time. We're going to be talking about what causes hyperhidrosis, and once you know what causes it, you'll know how to treat it. So in this video, we'll also be talking about the specific treatments you can do over the counter and in the dermatologist's office. So all things hyperhidrosis, here we go.
Here we go.
So hyperhidrosis, this is, all of us sweat, but this is excessive sweating. So this is to the point where you notice you're slippery all the time, you're sweating all the time, and it commonly affects the hands, the feet, the armpits, the groin, and a lot of times the face. And you can have other areas that are affected, but the most common form of hyperhidrosis is primary hyperhidrosis. This means that it's usually affecting both sides of the body, or it's focal, it's affecting certain areas of the body, but it's not caused by something else. So it's not caused by hyperthyroidism, it's not caused by an underlying condition. So in this video, we're gonna be focusing on primary hyperhidrosis and the main treatments for that.
Now, one of the misconceptions, or one of the many misconceptions with hyperhidrosis, is just because you sweat more, it doesn't mean you smell more. People with hyperhidrosis often suffer from a very difficult time just going through daily life because purely the humidity and wetness, but oftentimes it's not an increase of smell that's actually a product of this. Also, people with hyperhidrosis, because that moisture is always present, it can damage your skin barrier, can make you more susceptible to things like pitted keratolysis on the feet, can make you more susceptible to heat rash or intertrigo. So it's not just the moisture, it also does affect other areas of life.
So first you have to understand the different types of sweat glands to understand hyperhidrosis and the one that affects most people. And that is, what is an eccrine sweat gland?
So our sweat glands, we have apocrine, which we've talked about in our body odor video, and now we're moving on to talk about the other one, the eccrine sweat gland. This is the one that's most classically and most densely found in areas like the palms, the soles of the feet, and that's where you're going to have that odorless, salty, electrolyte-rich sweat. This occurs in response to both emotions, and then it also occurs in response to temperature changes. It functionally cools you down, so as your water evaporates, it leaves you at a reasonable survivable temperature in a hot, humid area.
So they can be stimulated by heat, they can be stimulated by emotion, they can even be stimulated by food you're eating. So if you're eating spicy food, you can sweat more, and it can also cool you off. Now, with people with hyperhidrosis, they excessively sweat. So the average person, Dr. Maxfield and I, we're going to be sweating anywhere from 1 milliliter per minute or around that area. So 1 milliliter per minute, but in somebody who has hyperhidrosis or severe hyperhidrosis can sweat up to 40 milliliters per minute. That's 40 times more than the average person is sweating. So what's happening on a molecular level? So you have your sympathetic nervous system that is releasing acetylcholine, and that acetylcholine is acting on these eccrine sweat glands to produce sweat. Now, when you have dysregulation, and this is what we think causes hyperhidrosis because it's not fully elucidated exactly what part of the brain is involved in this and what part of the nervous system or what is actually stimulating this, but we believe that you have some type of dysregulation of your autonomic nervous system that's releasing more acetylcholine, and that acetylcholine is hyperactivating those sweat glands to cause you to sweat excessively. Now, the sweat glands are normal in people with hyperhidrosis. They don't have more sweat glands than most people, and their sweat glands aren't larger than most people. It's just that their nervous system that's activating these sweat glands is hyperactive.
We know it can be a problem primarily from the neurotransmitters, and even though the glands themselves are normal, most of your treatments are going to be directed at one of these two steps to try to compensate for that dysregulation.
Really, that's the full treatment of hyperhidrosis. If you're either gonna block the nervous system to get it to stop sending acetylcholine or blocking acetylcholine on the eccrine sweat glands, or you're gonna block the actual duct or the lumen of the eccrine sweat gland, or you're gonna physically destroy the actual sweat glands. And those are really the three ways that you can treat hyperhidrosis. So let's go in from least invasive to most invasive treatments, and I think that's probably the best way to approach the treatment of hyperhidrosis. So let's start off with simply topical treatments for hyperhidrosis.
Most simply in topical treatments, things you've probably even tried intuitively, it's antiperspirants. So you can put deodorant sticks on the hands. I actually think this is a pretty reasonable and good place for some of those deodorant sprays because unlike a stick, they're gonna get well into the grooves of your hands and feet. And then aluminum chloride, which is an active ingredient in your antiperspirants, can also be bought in a liquid. This is one of the first things a dermatologist would recommend to you in the office as well. These all functionally have the same purpose of kind of blocking those sweat glands. So even though the stimulus is there, the sweat can't quite get out, and hopefully you have an improvement in the clinical side.
Right, so this is what you really want to look for, not deodorants, because there are deodorants and there are antiperspirants. I always have to say this over and over again. Antiperspirants block you from sweating. Deodorants just mask the odor from any type of sweating. So what you're looking for mostly, they have magnesium chloride too, but mostly aluminum chloride is going to be the one that is most studied, and there are concerns about aluminum chloride on whether or not it's involved in Alzheimer's disease or breast cancer. Those have not been proven. I continue to recommend aluminum chloride until more evidence comes out to the contrary. So aluminum chloride is meant to block your eccrine sweat glands, and there's actually some evidence that shows that when you use aluminum chloride and it blocks those sweat glands, it actually causes your eccrine glands to atrophy or shrink a little bit, making them less active. So when you first start using aluminum chloride as prescribed by your doctor or even over-the-counter ones, initially you'll have to use them every day. And according to the studies, you can use them less frequently over time because your gland should atrophy. Now, again, according to the studies, it shows that you should apply it to dry skin, and it's best to apply it at night and to leave it on for at least 8 hours before washing it off, and that's how you're gonna have the best effect with it. So it says after 2 weeks, you can use it less frequently. I'll trust those with hyperhidrosis to let me know how that works. So this can be used in the armpits. It can also be used on the hands. Can be challenging to use on the face because it will definitely block your pores as well. So that's going to be up to you. There are lotion forms of these aluminum chloride antiperspirants that you can use in other areas.
Right, and I will say though, it can be a little irritating, especially the solution for those of you who are going to shave your armpits and then apply the aluminum chloride. Watch out. For the hands, other areas, that's not really as much, if any, issue.
Now, staying in the realm of topical treatments, there are prescription topical treatments that you can try as well, and the most common form would be something called glycopyrrolate. Now, this comes in a prescription trade name of Qbrexza. And it comes in like a little wipey, and you can use these on the armpits, you can use these on the hands, and basically what they do is they actually block the receptor on the eccrine sweat glands from being able to react to acetylcholine, essentially. So that acetylcholine is never able to really attach to the receptors and basically stops you from sweating by that mechanism. Now, it's hit or miss on how effective people find these. They do last quite a bit of time, but there are certainly some risks with these little wipies. One, you can't touch your eyes when you use this, and I'll show you a really good picture here of my friend. Once upon a time, he touched his eyes after using these, and he sent me a message and he said, am I gonna be okay? Because one of his pupils was really, really dilated, because when you block acetylcholine, it causes mydriasis, or dilation of your pupils. And so his entire pupil was super dilated because he had touched his eyes. If you are going to be using these little wipies, make sure that they don't get in your eye, because if they get in your eye, it will dilate your pupils. That's not necessarily harmful unless you have open angle glaucoma or closed angle glaucoma. If you have closed angle glaucoma, you shouldn't be using these.
Exactly, just be careful, wash your hands after you use it. But that does speak to the hands. This is only approved, FDA approved for the armpits. So getting that exact product for your hands is quite difficult, if not impossible. However, there are other ways to get this ingredient compounding, even something like skin medicinals or something of that like. Your doctor or dermatologist might be able to get it for you that way. I find for the hands, it's not quite as effective as for the armpits, but again, for hyperhidrosis, like many medical conditions, it's just like what works for you. This could be a great option.
Make sure that you wash your hands afterwards. So it's a good option for you, but only available by prescription. Next, let's specifically talk about the palms and the soles. So I'm gonna talk about this sort of generally because my brother-in-law has hyperhidrosis, and this is something that really bothered him. And right when I became a doctor, he immediately was like, you need to treat my hyperhidrosis. This was even before I had become a dermatologist. The reason was that his hands were really sweaty, and he was in a field consulting where he met with a lot of people and shook a lot of hands. He hated shaking people's hands because his hands are sweating all the time. And I have a lot of patients that come in like first boyfriend, first girlfriend, and they don't want to hold their boyfriend or girlfriend's hand because their hands are sweaty and they're embarrassed about it. And so this is a very, very common problem that affects multiple age ranges, and treating the hands is different than treating other parts of the body. So when you're treating the hands specifically, the actual treatment of choice for this is something called iontophoresis. Iontophoresis is a process of putting your hands in a tub of water that is electrified, and that tub of water needs to be filled with tap water, by the way. And by electrifying this water through this iontophoresis machine, it basically propels hydrogen ions into your eccrine glands. And they don't really know why it works, but it seems to work at anywhere from 80 to 100% depending on what your studies show. And so basically what ends up happening is that either it's blocking it with the hydrogen ions or it's messing up the electrochemical gradient. But initially you start off doing this about 3 to 4 times a week. And then after about 2 to 3 weeks, you can get to the point where you're only doing it maybe once a week. And eventually it really should help you reduce the amount that you're sweating over time as long as you're consistent with it. Now, for a long time, we only did this in the office. So you'd have to come to the office 3 to 4 times a week initially, and then less frequently as time went on. And now they have at-home iontophoresis machines. One of them is Dermatologist. I've talked about it probably a long time ago, but it's a really good device. It's probably the most affordable device that I've seen, and it works exactly like any of these other iontophoresis machines. You do need a prescription. I think you can do it through the website.
Have you ever tried it?
Yeah, it's a little uncomfortable.
It is uncomfortable. So yeah, same thing. I think I've said this on this channel before, but I do, whenever possible, try to go through what I ask my patients to go through. And so of course I did this as well. It definitely tingles. It's an interesting experience. You are electrocuting your hands in a sense. You're running current through them. It doesn't necessarily shock you unless you do something wrong, like elevate one out of the water. But overall, it's a very tolerable experience for most. The effectiveness, I think, is actually tremendous. I do believe that even this step can be very significant, impactful, or potentially life-changing for someone who really struggles with this.
And now, if you do have any like pacemakers or anything in your body that is reliant on a battery of sorts, just be careful with running current through your body at all. So that would be the contraindication to this machine. Now, we're gonna stay within this same frame of talking about this focal or local or localized hyperhidrosis. And the next one would be botulism toxin, also known as Botox. You can get Botox to help with your sweating. So let's talk a little bit about how that works, because we do know that there's something happening with acetylcholine now. And if you know how Botox works, you'll understand why it works for sweating.
Right, so Botox or botulinum toxin acts on the presynaptic nerve to prevent the release of acetylcholine from the vesicles to act on your muscles. But in this case, just because it stops the release of acetylcholine, it has a different functional effect on your sweat glands. So same thing, you stop the signal, you stop the end result, and sweating can improve. Now, because of the location, there are a couple problems or difficulties with this. For the hands, for the feet, it can be quite painful. There is some consideration, especially for the hands, where you might get some weakness in those muscle groups as well. Not like your face, and not like you can't move them, but typically you can experience a little weakness. One area that this is commonly used for, however, is the armpits or axilla. Quite effective. I do this procedure a decent amount. The results can be extremely good. Again, just black and white. Amazing difference for people who undergo this.
Definitely. So I have done this procedure quite a few times. I've done it on the hands, I've done it on the feet. It's very, very painful because you obviously have a lot of nerve endings in these areas, but it does work really, really well for people who have failed the other treatment options. When you're talking about the armpits though, we can get very localized with it. We'll show you an example of what the starch iodine test looks like. And the starch iodine area that lights up, that area is the area you really want to inject with Botox, because this is the area where you're having that excessive sweating over time. And so that color change occurs to that bluish color when sweat interacts with the iodine test. And when that happens, we know exactly where to inject the Botox. Now, you don't have to do this because we generally know where people are going to be sweating, but it is a good way to just be more localized with your Botox. Now, when you're getting Botox done, it generally is covered by insurance. Now, you want to get a pre-approval for this because otherwise it's going to be very, very expensive. But if the doctor can submit a pre-approval for this and get you approved, they can order the Botox, they can have it sent to the office, and they can inject you, and it generally should be covered by your insurance. Botox lasts about anywhere from 3 to 4 months. In my experience, most patients with hyperhidrosis only need treatments every 4 to 6 months. And so that would be my recommendation for people. Now, it will last long, it will work well. It is painful during the procedure, but for some of my patients, it is completely life-changing for them. You do need to inject a little bit more superficial than you would when you're doing the face for your muscles, but it does work really well. Now, that being said, if you have hyperhidrosis on the face, getting Botox in the face, superficially injected, small amounts, can help with hyperhidrosis of the face. You just want to make sure that you're not injecting any muscles that would affect your facial movements.
Right, yeah, so just be thoughtful where you put it, but I completely agree. It is a nice way to use a side effect for a positive benefit. It can really do two things at once there.
Now, finally, in this category, this one is specifically only for your armpits, is something called MiraDry. So MiraDry is microwave thermolysis of your eccrine sweat glands. So it basically microwaves your sweat glands by activating essentially your water molecules, and it destroys your eccrine sweat glands in your armpits. And it works incredibly well. About 90% of people have efficacy through an entire year.
You know, it's something that needs to be thoughtfully done because it is destructive. Like, there are some considerations for damaged structures in the adjacent area, but the results can be, again, extremely good. And I think, just again, emphasizing, for some people, this is a fairly debilitating thing. It's something that enters all aspects of their life. And so when you're considering the risk benefits, it's worth it to some people to like say, okay, I want to do more than this. I want to do more than this. I want to get to a point where it's gone, even if there's like a little risk involved, but it is a good option with good results.
Because there is the brachial plexus that runs through here, it's not generally supposed to go that deep. You're only supposed to get superficial fibrosis of the skin. But if it does go too deep, you do have a neurovascular bundle that runs underneath your armpit. And if it's damaged, it can cause brachial neuropathies such as median nerve or ulnar nerve neuropathy. It's super uncommon, but it is a risk, and it's something that you'll talk to your dermatologist about before you get any treatment. Now let's go on to moving away from the focal hyperhidrosis, which is affecting just certain parts of the body, hands, feet, armpits, to the more generalized form of hyperhidrosis, where some people just sweat excessively over the entire body, and in which case most of these treatments would be impractical. You can't apply anti-perspirant all over the body. You can't apply topical glycopyrrolate all over the body. You can't put Botox all over the body, and you can't use this MiraDry anywhere but the armpits, right? So this is where you're gonna have to be thinking, how do I stop sweating over the entire body?
Right, and so naturally you're talking about something from the inside out globally. So glycopyrrolate, the pill, the oral form, is going to have a similar effect, where you're going to stop the neurotransmitter from interacting with the receptor on your cells, thereby decreasing the sweating. And can this help with some of the focal issues? Absolutely. It can be helpful perhaps for the hands, for the armpits, for the feet, but it is going to affect a person overall. And so because of that, a major consideration is that sweating is functional. It first and foremost is a way to cool us down if we're hot. So if you're someone who's an active lifestyle, if you're someone who works outside, you just have to be aware that it does decrease your sweating. There probably is a theoretical increased risk of developing hyperthermia because you can't compensate for the environment around you as well. But again, it can be effective. It's a very routinely used medication for this because it's a very functional purpose, and it's very helpful.
So this is something where you're going to start with a low dose until somebody gets used to it, and then you can increase it as tolerated to certain levels. Now, it is technically not FDA approved for this purpose, and many things that we do are quote unquote off label, meaning that we recommend things that we know work but aren't necessarily approved for that indication. It works incredibly well in a lot of my patients, but you really do have to be careful, and some people do get side effects that make them stop using it. Basically, anytime that you are going to stop the effects of acetylcholine, you'll get all the effects of stopping acetylcholine, right? So again, you can have the same thing that you would get with topical glycopyrrolate, which is dilated pupils. You can also get dry mouth. You can get inability to urinate. So what is that called?
Urinatopia. No, I'm just kidding. I don't know. I don't remember.
So yeah, you can have trouble urinating. You can have many other issues. And like Dr. Maxfield said, one of the bigger risks would be hyperthermia or overheating, essentially, and having something like a heat stroke from not being able to thermoregulate yourself. So there is some risks with this, but I haven't had any patients that had any real issues with it. It mostly is just like dry mouth or dry eye that makes them stop using this medication. And we usually start low and increase it as tolerated. Now, most of the time, glycopyrrolate doesn't cross the blood-brain barrier as easily as some other antimuscarinic agents, and so it is a little bit safer when you talk about oral anticholinergic agents. Now, that summarizes most of the treatments that we're using on a monthly, daily basis when we're treating hyperhidrosis in the office. And when you go to see your dermatologist, these are most of the treatments that they'll offer you. Now, the final and last treatment, when all else fails, is something called sympathectomy. Sympathectomy.
Yeah, sympathectomy.
I feel like there's more P's in it than I just put out there. What is a sympathectomy?
So basically, a sympathectomy is you're going to surgically denervate. Now you got me going. Denervate. Remove the nerves that provide the actual sympathetic and cholinergic signaling to the nerves here. It's surgical. It's permanent. I think it's definitely a rare option, an exceptional option, not done routinely. But again, perhaps for the wrong or right person, it would be useful.
Right. And I'll be honest, I don't have much experience with this. It's not something that dermatologists or any dermatologist that I know perform. Not just that, I've never recommended a patient have it done. I've never had a patient that had gotten to that point, but I have had patients who have had it done. So they've had hyperhidrosis, and by the time they had seen me, they came to see me for something else and had told me that they had this sympathectomy done. Most of the time it's without any issues. Sometimes they just localize, like let's say you have localized hyperhidrosis to a certain area, they'll try to ablate the certain nerves that are affecting those areas, and it works really, really well. Sometimes it works up to 100% of the time, and this is really going to be based on the skill of the person performing the procedure. And so this is really a last resort once you've failed all the other treatments out there. And if you fail all the other treatments out there, there's always the option of being patient, because in the event that something new comes out that could be a better treatment, like we didn't have MiraDry 5 to 8 years ago, and so there's always new things that are coming out that could be helpful for you. So there are options out there for people with hyperhidrosis. Like I said, I have family members that are affected by this condition. I have tons of patients that come in with this issue. Try with the least invasive and then go to the more invasive options. There are a lot of options that are out there for you. Most of the time we can get you to the point where you are more comfortable.
Right. So even with the sympathectomy, like Dr. Shaw mentioned, sometimes it works 100% of the time.
Did I say that?
Yeah. 50% of the time, it works 100% of the time.
That's an Anchorman quote.
It is.
I'm kind of a big deal.
So this is really the whole spectrum of treatment options. Honestly, this is one of the most algorithmic, straightforward conditions to treat, in my opinion, and honestly, insurance typically follows suit, meaning you have to try A, B, C before you can move on to X, Y, Z, but you may not have to go so far down this algorithm to get the results you want. Many people have this condition. The majority of people with this condition wait years and years and years before actually trying to do something. So hopefully, purely because this video is accessible and available for free, I'm hoping that this is just the impetus for people who really are bothered by this to know that there are a lot of good and effective treatment options out there. So if you have this, like, take advantage of the information. If you know someone who has this, like, gently and out of love and kindness, like, share it with them graciously. But hopefully this is helpful for a lot of people out there.
This is probably worth a Skinpedia article, so we'll summarize this video in an article. You can click the link below and you'll be able to read all of this if you didn't take notes. And also we did a video on bromhidrosis, which is body odor, which is not the same thing as excessive sweating. So if you want to watch that video, you can definitely go check it out. Please like, comment, and subscribe. We appreciate all your trust and support, and we will see you all in the next video.
See you next time.